So for today, I will deal with experiences in my organization with systematic reviews in a clinical research program. And then, halfway in my speech, I will introduce the newest developments in the 3R developments in the Netherlands. But first, the use of systematic reviews in what I said, a clinical research program, to be more specific in our healthcare efficiency program. And that's a program in which health technology assessment is used to solve important problems in daily healthcare. And this program actively promotes research on recognition, assessment and implementation of cost-effective intervention and fosters generalization of knowledge. It's an important program in the Netherlands. It's a continuous program, and we have an annual budget of approximately 10 million euros. And as said, in this program, systematic reviews are obligatory. The way we work is that when we open a program, so we publish a call for ideas, first step is to get ideas from researchers that are brief summaries of the proposed research. So there's not yet a full proposal. In these project ideas, we try to make a shift because we always get far too many ideas to be granted. So we give the people a positive or negative advice. If you have got a positive advice, then you can go into the second stage and send in a full grant application. And in that part, the systematic review is obligatory. And a meta-analysis is welcome, but that is not obligatory. So why do we ask in this specific program for a systematic review? Well, and we have heard it before this morning in the excellent presentation, is to identify clear knowledge gaps, but also to find out whether or not the proposed research is of additional value in comparisons with former research. So we want to see published in the review what's already known on cost effectiveness in the specific case of the intervention, or if it is an implementation study, the knowledge on the implementation, which is under study then. And we also like to have an overview of currently ongoing studies with a similar subject. So and now I will deal with the process when this grant application is sent in. We have asked for a specific design. So where the systematic review has to be made transparent. And first of all, that has to be done by to explain the search strategy, was already mentioned this morning. But also the selection procedure has to be made clear. And especially I would like to repeat what we heard this morning, the criteria to include and to exclude manuscripts. And then, of course, the results of the overview of found manuscripts, quantitative, qualitative, and then especially here, the focus on primary and secondary outcomes, effectiveness, cost effectiveness, and as an enclosure, a table with the overview of the found manuscripts. So that's the whole file that has been sent in our program, and then will be made part of our grant review process. Of course, and you are all acquainted with it, I think, with a review process that's on quality anyhow, and in this program, especially also on relevance items, and I will dwell upon relevance in a minute. But the review is more than only the systematic review, it's also on the total proposal, but I will focus only on the review process with regard to the systematic review. We ask our reviewers or referees, the independent referees, to consider the selection of search items, whether or not all relevant databases are included, the selection of papers, but also, and I think of great importance, do you miss any references which are relevant for the proposal? And of course, are the conclusions of the systematic review justified? That's on the quality judgment. Then, as said a minute ago, on the relevance issue. Because in practice-oriented research programs in our organization, we do not only ask for quality of the project, but also on relevance. And on relevance, you have to understand that is, does the proposed investigation solve a practical problem in daily healthcare? And relevance items have to make this clear. And with regard to the systematic review, the question, is the project innovative, or will it yield new information? And is there any duplication? And if efficacy of the intervention is described, is it sufficiently demonstrated through such a review? We work since the year 2000 with systematic reviews in this specific program. And I have to explain, this is exceptional because in other programs we don't ask systematic reviews. And we have asked different people about their experience, and also our own people in our commissions, the scientists, and of course my own staff. And the general impression with this specific program is that asking for systematic reviews is that it is seen as an objective and verifiable process. It gives useful and essential information. Often it leads to a better motivation of the proposed research. And the research question often is better focused. And often our reviewers note that some relevant manuscripts are missing in the review. And I think that's a very important lesson that we have to learn and to be keen on. As always, there's a big but on this. Because people say, well, this is another step in the bureaucracy of a science granting organization. And then we say, well, isn't it what you should know already before you design your proposal for research? And on the other hand, scientific reviews are easy to be published, so it is also a benefit for you. And I have to be honest, in our scientific community for health technology assessment, systematic review is well accepted. They are very experienced in it because it's already being practiced so for a decade or more, a little already. So this is a specific group, and let's say in general this group is positive on this obligation in our research program. But in discussion with other scientific groups, very often the complaint is it's another step in your bureaucracy. So I think for other programs we will not make it obligatory yet, but we would like to have further discussions in the different scientific communities. And I think the things which were discussed here today might be helpful for the discussions with the other scientific communities, and I also hope that different people being here in the audience will be willing to go on with that in the very near future, because I think this should be debated. Well, this is half my speech, and it is the experience with systematic reviews in one clinical research program of our organization. Fortunately, in our organization, we also have a 3R research program. And this program, quite new. It was launched at the end of last year. It builds on different activities which we had done before in our organization, but also elsewhere. And it was committed by the Minister of Health last year. We worked with a program committee, and recently we made known that we have a new chairman for this program committee. It's Dick Tonnel, former State Secretary for Environment and Housing, and he's very keen on this issue. And the vice chairman will be Bert van Zutphen, well known in the world of laboratory animal science. Bert van Zutphen will, in this program, deal mainly with the scientific granting procedure. So what is this new program about? Well, we have program goals, and the first one is development of innovative 3R methods, of course, but also, and it follows from the mission of our organization, attention for implementation in practice of new and existing 3R methods. What are the general program conditions? Oh, I think everybody can imagine that these issues which are mentioned here are self-explanatory. Of course, we like to have multidisciplinary research, the collaboration between relevant stakeholders, a chain involvement. I told already about the knowledge chain, but here in this scheme it is innovation cycle is a bit more dynamic. So when we have nice results from basic science, we like to go on in more applied science. But after applied science, we like to make a next step, attention for implementation, because implementation is a difficult issue. And very often implementation requests also proper scientific research. So we like to fill this whole cycle in this program. And we also have attention for publication. We'll dwell upon this in a minute. And once again, the implementation of the gathered research. How is the structure of our program? We have a structure of modules. So we have different possibilities for people and organization who can say, we want to give an assignment for a very specific module. And 2 modules have already been commissioned. The animal-free research technique, commissioned already by the Ministry of Health, as said before, and also Amendment 21. I will explain also in a minute. But we have many more and higher ambitions. So we have possibilities of introducing other 3R modules for organizations who are willing to participate in this program. And I would welcome such a participation. The present budget for the program assigned by the Ministry of Health is approximately 5.5 million euros for the total program. So for some might be huge, for others might be a low amount. In my opinion, it's just the first step, because we have so many good ideas and they need really much more money than this. But we see it also as an obligation for our organization to convince other organizations to participate in this program. As said, we start already with the research projects, the granting procedure on the module of the animal-free research techniques. And it's especially dedicated to cancer or some other human diseases. And we like to welcome public-private partnerships and, of course, the multidisciplinary collaboration. We also like to give further attention to ASAT, Achieving Safety Without Animal Testing, an initiative from Bart Sangster, well known, I think, on product safety, and again, on implementation projects. And the procedure started at the end of last year, and we closed a few weeks ago. And we expected probably 40 proposals. Well, we got 64. We can only afford granting approximately 10 projects. So the first step will be, unfortunately, to bring these 64 project ideas back to 30 who get the invitation to send in a full application. And then from the 30 we will go down to 10. But from the others, if they get a good review, I hope other organizations will come in and provide for additional money. Then I'd like to finalize with module Amendment 21. This is an initiative from Parliament, raised extra money, additional money for our program, and it is especially dedicated to strengthen scientific infrastructure on the 3Rs. And that has to do with the publication of negative results and, fortunately again, systematic reviews. I will deal with the 2 of them. Negative results involving animal studies. Let me raise a question to you. It was my own question too. Do you think that there are specialized scientific journals dedicated to publication of negative results? Or isn't it? So those who think there are scientific journals dedicated to negative results, please raise your hand. Those who think not, don't raise your hand. Well, it's not so much. I had the same opinion. There are no journals. Fortunately, as I have understood, there are already 3 scientific journals, especially for the publication of negative results. And I have two titles, Journal of Negative Results in Biomedicine and the Journal of Negative Observations in Genetic Oncology. And there's even a third one. And I think this is a fantastic initiative. And we like to support all the scientists in all the ZonMw in our organization programs, so not only the programs I mentioned a minute ago, but all the others who got negative research finding, which of course are, I think, scientific of great importance. We learned it this morning, that all these results get published in the very near future. And as a very stimulus, we would like to make this possible through additional financing for publication. So that will be, I think, an important next step, of course, in our country, but I hope this initiative will be followed by many other granting organizations to stimulate publication of negative results, thanks to the amendment. The other part of the amendment is synthesis of evidence. We have also a little bit of money to go on with this, and the specific things which we addressed in our program are workshops, support for workshop participants afterwards, and also training activities. And I think next month, or at last in April, call for this infrastructure will go open, and we await interesting new ideas in these two fields, publication of negative results and systematic reviews. Well, ladies and gentlemen, this is the present situation, of course, we all recognize. But if we all work very hard and keep our ambition, this might be the near future. Empty laboratory animal cages. Thank you so much.